Today we have Dr. Rick Jahn, who is a Chinese medicine doctor and a functional nutritionist.
Hey.
So welcome.
Thank you. Thanks for having me.
Yeah, so tell me, how did you get involved in this? How did you decide to do this for a career?
It's a weird path, but basically, I didn't know you could become a Chinese medicine anything living in the United States. And I was researching nutrition schools, and I found out that was a possibility. I thought you had to live in China for that. They never talked about that at career day, you know. So I researched it, and I found a school I liked, and I went to school. I had a master's degree in Chinese medicine, and then I studied more nutrition afterwards.
And so how many years have you been doing this now?
23?
Wow.
August will be 23 years. So that's been a bit.
Yeah, that's exciting. I feel that inflammation is totally responsible for pretty much every disease and process in the body. How do you look at that, and how do you handle that in your practice?
So, especially from Chinese medicine aspect, the problem with inflammation, as far as I'm concerned, is when you say inflammation to a patient, they say, oh, nothing hurts. Correct. Right? But inflammation is more insidious than that. So we look for small signs and symptoms. It's inflammation that they haven't recognized yet. I agree. I think it's at the root of a lot of different disorders. But Chinese medicine, we're all about balance, right? So if you have inflammation that's not being addressed, it's causing stress in the system, always causing an imbalance. The problem is most patients don't notice the imbalance until it causes dysfunction. And then they're like, oh, it came out of nowhere. But really, it was building for a long time.
Manifesting for a long time.
Yes.
Right.
Yeah. And it's all, choices that we make out every day. It's, food and our habits and, whatever we do. But, and people think that they don't have inflammation just when they don't have pain. It's two separate things.
So what type of lifestyles or foods do you find that cause an inflammatory process in a patient?
So actually, the example I used to give all the time would be like if you had RA patients with rheumatoid arthritis, right? They have an immune system has kind of gotten haywire. They have inflammation. They know they have inflammation, and they feel the inflammation, right? So the best thing you could do to feel it more would be, I don't mean to pick on McDonald's, but it's really not food. So go out and have McDonald's with some large fries, and you're going to feel it.
And a huge pop. Or, I'm sorry, Coke, depending on your liver soda.
We don't call it pop.
Right.
But yeah, so, and then you feel it.
Right.
And other people are like, well, I'm lucky, I don't have that. No, you do have that. It's just their barometer is more sensitive. Most people don't think they have that, but they're getting it too. They just don't feel it as often. And they just think that they've escaped it. So any of these processed foods, seed oils are horrific.
Explain seed oils, because some people don't know when you say seed oil, they don't even know what that means.
Okay, so the real big pet peeve, right? Over the last few years, they've been pushing canola oil as a healthy oil. It's not a healthy oil. It actually was a machine oil that they used in machines, and they repackaged it and they made us consume it. If you ever look at canola oil before they washed it in hexane and filtered it out, it's gray, it smells bad. It is a damaged oil. Well, what happens when you consume a damaged oil? It is pro-inflammatory, right? So it looks pretty on the shelf, but that's because they made it pretty. They put, it's kind of like putting lipstick on a pig, right? It's like they made it pretty, but it's not pretty. It is quite inflammatory. And for people with RA, they will notice it more because they're so sensitive to it, but it affects all of us.
So you mentioned canola oil. What other oils would be put under the category of seed oils?
Vegetable oils. So I'm not a big fan of vegetable oils, seed oils. Olive oil, if it's real.
Sure.
And I know everybody gives me a side-eye look about this, but I don't think we should be cooking with olive oil. Olive oil is pretty sensitive to heat. It comes in an opaque container for a reason. It can't even handle sunlight. So, very, very light heat, but really it's really eaten raw,
Now I use a lot of avocado oil. What do you use if you're using high heat?
So I use animal fats mostly. I use coconut oil sometimes. I use animal fats for the most part. So avocado oil, I am on the fence about. Okay. I've heard some bad things. I've read some good things. I don't know who to believe at the moment, so I just don't use it that often.
So when you say fats, are you cooking bacon and saving lard? Like, what are you
I
doing?
I do actually. So I get bacon that's no hormones. We store toxins in our fat. I hate the word toxins.
No, we do.
Right. So if you have an animal that was mistreated, who is pumped full of hormones, who's eating foods that they shouldn't be eating, it shows up in the fats. So I'm not a vegetarian by far, but the animals have to be treated with respect and raised properly, and then that fat's healthy for us. If it's raised improperly, you might want to avoid that fat.
Well, and that's how I even look at food. Like for my family, we make choices where we're doing grass-fed.
Yep.
Like I really don't want to be eating animals that have been fed all this corn and processed stuff. And
Well, especially since cows don't actually eat corn, right?
Right.
So when they eat corn, they're actually more inflammatory. So the omega-3s, the omega-3 to omega-6 ratio in a grass-fed
Right.
cow is neutral to anti-inflammatory, where a commercial feedlot cow is actually pro-inflammatory. And you're like, oh, I don't feel it. Yeah, you will.
we will eventually.
It's getting there. When they tell people, oh, wait till you get older, you're really going to feel it. I don't believe that's actually true. I think that the damage that we do when we're younger, we don't feel, because it's a fresh slate. And as we build up that damage, then eventually you start feeling it. And you're like, oh, it's because of age. Maybe, but also it's because of these things that we thought we can get away with.
Right.
You have a Snickers bar and a Coke and you're at the door when you're 18. Try that when you're 80. You're not going to feel too good.
And I even tell that to my patients that are getting up to menopause age. Everybody like hacks things off. It's menopause. A lot of it could be that your body's toxic. Yeah. You've been dealing, like you're saying, with aging in general. Yes, these people are in their 50s.
Yep.
All this stuff's starting to happen.
Right.
Well, I should say it's been happening.
It's been
they're
happening.
starting to feel it now.
Well, so like the HPA axis, everything's in balance, right? So menopause, my example for that is, because I'm addicted to my own analogies, but is like riding a bicycle with training wheels on. You were off balance already. You didn't notice because the training wheels, the ovaries, were kind of keeping you in balance. But suddenly, somebody ripped the training wheels off and you fall down, and you think it's because of menopause. Not you. You obviously know the difference. But people think it's the menopause, but the ovaries being within that HPA axis kept you in balance, and now you remove those, and now you found out you had a lot more imbalance than you thought you had, right? And it becomes more apparent. And now it's all because of aging. Yes and no. We have to be more careful because now it shows up more.
So back, because I know we're talking about inflammation, I know you're mentioning diet, and we're talking about, how about lifestyle a little bit? Because a lot of people, I could speak, and I want to hear it from your perspective, what people are doing every day in their lives that are just adding to this toxic load or adding to things to kind of increase the inflammatory process in their bodies.
Lots of things. So sedentary lifestyle, which I'm really bad about that. When I get too much into my head, and I'm doing research for projects or writing, and I don't move as much. And your body will tell you. And then people say, oh, it's because you're getting older. No, it's because I'm sitting on my butt.
Right.
But not exercising enough, but also exercising too much. Exercise is a stressor. If you're stressed and you push too hard, you're adding more stressors, right? Pro-inflammatory foods, as we discussed, exercising too little or too much is a thing, but sleep is huge. It's really hard to out-supplement a bad diet and poor sleep. If you get under, it's 8 hours, but let's be realistic and just say 7 hours. If you're getting under about 7 hours, it's really difficult to maintain weight. It's difficult to have good digestion because your cortisol's up.
Correct.
So your inflammation's going to be up. And so people are like, oh, what's the new superfood? Before you go to superfood, let's go to bed a little earlier. Let's move our body a little bit more. So all these lifestyle choices that we make, people are looking for the thing to correct, but then they sit too much, or they exercise too hard, they don't get enough sleep, they eat pro-inflammatory foods. These are all the lifestyle things that I talk about.
What would you feel about, because I think another big, you want to hear it from you though, is just chemicals in people's lives?
I'm pretty. I'm not quite militant anymore about the chemical thing, but I really try and keep the chemicals out of my food. My 11-year-old is really tired of hearing it because he'll come home from school, he just wants to be normal, and he'll have chips. I'm like, and I explained to him what's in it, but he's 11, so he doesn't really care. But I'm like, how could you possibly eat that? And then I feel like a bad parent because he ate it, and I tried to logic and reason that out of him, and that didn't work. So yeah, I think there's a lot of foods that we eat that are horrendous, and if if you ever want to have snacks again, don't learn about how bad it is, because I wanted a snack. I'm like, I won't care. And I went to the store and I picked up a snack and I looked at the back. No, I can't do that one. Can't do that one.
There's like 3 I can have maybe in a grocery store if I'm
right?
even. Actually, most of the time it's not even that. Maybe 1.
Yeah. So, and because once you know, you're like, I can't do it. That's like sucralose,
Right.
Splenda, and fake sugars. Can't do it because I know how bad it is. It's like, oh, this one won't hurt you. I'm like, actually it will. So
I've got a story about
it.
that, and I feel bad if this person ever listens because it was done with love. But I had somebody just this past week make a beautiful cheesecake for my family. Well, I'm not supposed to even have dairy in the first place. But anyway, the cheesecake was there. It was beautiful. I said, I'm going to have a bite. I was so excited to have a bite of this cheesecake. I haven't had cheesecake in a really long time, and it tasted like poison. So what I found out, it was sweetened with Splenda.
Yeah.
And I wanted to cry, and I literally had to spit it out.
Because you can't, because you know. So as you know, and a lot of patients don't know, is it causes a leaky gut type situation,
Right.
even from just a little bit. So again, my analogies, but I've heard people say, well, it's just a little bit, won't hurt you. And I said, well, would you say just have a little bit of heroin and won't hurt you?
Right.
Like that's ridiculous, right? So to me, it's the same thing. A little bit of chemicals, it causes an imbalance in your body, an imbalance that your body now has to deal with. So if you already have liver issues, or if you already have inflammation, you already have digestive issues, you just cause a bigger imbalance, and it may or may not show up, but it's something your body definitely has to deal with, whether you recognize it or not. If your body's doing a really good job, you may not recognize it, and you think you got away with it, but you didn't. You know, your body still had to deal with it.
What do you think about chemicals in regards to things that people are putting in their bodies or things that they're using in their house? Does that...
Yeah, I'm a little less militant about those. It's definitely a thing, except when it's time to clean the house, you know, it's like hard to switch over to something else. I try and use less caustic type chemicals.
Correct.
You know, you figure you spray it on the walls and the paint peels off, you probably shouldn't breathe it in.
Right.
You know, I used to, many years ago before grad school, I worked in a motorcycle shop, and we would wash parts in parts cleaner without gloves. And nowadays, people would be like, oh, you don't use gloves? But back then, nobody used gloves.
Correct.
And now you look back and you're like, you've got cuts in your hands, and you're in this caustic, really toxic material. And you're like, how did I live through the day?
Right.
You know, it's like, but that's what happens, you know. Really, maybe a good example of that, I've done some fasting before, and my longest fast was like 10 days, right?
Oh my gosh,
And,
I've only done like 60 hours. I'm impressed.
Well, so I was supposed to do a month,
Right.
but then it all kind of fell apart because I thought I was too slick. So when I did my fast, it was pretty easy. It wasn't that bad. It's the first couple of days you're really hungry, and no big deal. So I didn't have any kind of detox reaction. When I was in China, I was in Shanghai, fairly toxic city. Different story. It's the day one, I was throwing up. I felt like I had the flu, and it took me a minute to realize it's from the detox symptoms, because you don't feel the toxins,
Right.
but they're there. And that was the only difference. I couldn't do it. It was too harsh to do a straight water fast in Shanghai. I had to modify it because there was too many toxins in the system.
The additional toxic load was just taking it over.
It
the
was
top.
ridiculous, you know, and you know, as we've discussed before, you know, liver detoxes in stages,
Right.
and it makes the toxin, again, don't like that word, but it makes the waste product more toxic before it gets rid of it, and if you can't get rid of it fast enough, you feel bad.
Correct. So what types of dietary or lifestyle choices that people are doing that you're seeing that people just might not even expect?
Actually, I just wrote an article about this.
Okay.
And this was kind of near and dear to my heart. So other than caffeine, what's the most accepted drug that?
Sugar.
Sugar and alcohol, right?
True.
Okay.
Which actually is
Sugar, right? Yeah, to you and I, it's sugar.
Right.
Alcohol, I think, is not huge. It's gigantic. And here's the thing. So let's say 2 drinks a day. We're adults. We're not getting hammered. We just have 2 drinks a day. Not a big deal. 5 days a week, so 2 beers, 2 whatever. The problem is a lot of people end up getting fatty liver just from that.
True.
Well, with the fatty liver, now it throws off everything in your digestive system, but on top of that, you build up adipose tissue behind the abdominal wall, which is pro-inflammatory.
Right.
So it's literally like a pro-inflammatory machine that's now running. So even when you're like, I'm going to clean up my diet, yeah, but you have this machine that's just pulling you back down. All from something as simple as, let's say, a couple of drinks a day. So I actually have experience with this, and it takes a while to recover. I think it's something like up to 30% of people in the United States have fatty liver disorder. That a lot of them don't even know it.
You know what I remember years ago, and this broke my heart, years ago in my practice, somebody came in and they opened their heart to me about how their doctor, no, this was like, I know you're saying, due to like the 1 to 2 drinks on a continual basis. But this was a patient that I know was telling me the truth, was not a drinker at all. And the doctor was blaming her on drinking.
So I think actually we've talked about that patient before.
Well,
so
exactly.
What I think now is, so they have non-alcoholic fatty liver disease.
Exactly.
However, I think my personal take on that is you got high fructose corn syrup.
Exactly.
Okay, you've got sugar in everything. You've got chemicals, and you also have seed oils. So when you take one in isolation, you're like, it's not so bad. But it's not in isolation. It's all together.
Right.
And they all in common are impacting your digestive system. They're impacting your liver. They're impacting inflammation. So I think all of those together are just a cocktail of disaster, really. And I think that can mimic can limit alcoholism. As a matter of fact, I think it was in the 50s and 60s, patients were being accused of being alcoholics.
Exactly.
Because they didn't understand that you could have non-alcoholic fatty liver disease to this degree. But for some people, it's really bad. And I blame seed oils and these other inflammatory type foods. Because you're getting all the negative of being an alcoholic, but you're not a drinker. Because the mechanism is still the same. We're still damaging the liver, right? So to the doctor, the MD, I don't want to blame the MD on this because back then they really didn't know. But when you're looking at the liver, and you're like, what damages the liver to that degree? Alcohol, yes, but they didn't know that they're pushing margarine for how long? Margarine's hideous.
I always say, eat the real thing.
Yeah, exactly. Margarine, nobody should ever consume margarine. You know how many times I've been to a restaurant and I ordered something, I said, is that margarine or butter? They're like, oh, margarine. And they're proudly, it's margarine. I'm like, how about dry? Don't put that on there.
Exactly.
And they're always shocked. And I'm like, it's hideous. Nobody should be consuming this stuff. But some people may never notice. But some people might end up with fatty liver disease just because their body can't handle all these pro-inflammatory things like seed oils and the corn syrup and all the rest of that.
So you have a patient that comes in that's kind of your average American that's just kind of going day by day. Where do you start? Because, I mean, sometimes even for me as a practitioner, it can be very overwhelming when you're looking at this whole big thing.
So, actually, funny you should say that. I'm actually, because of that question,
Right.
I'm actually writing a course that I just want it to be free for people to use. And I'm calling it a foundational course because it's a longer conversation, and I couldn't shorten it any shorter than 6 weeks because I felt like it was too much. So we start with just recognizing where you are, and I know this sounds goofy, but a lot of people, you know what you're eating because you've made that effort, but a lot of people don't even recognize where they are. So the first week, I just want them to recognize where they are. How many of your foods come out of a box, out of a can, right? Just there, okay? And then what I have them start doing is adding things in before I start taking away. Because what often happens is they don't know what to eat. You took something away, they don't know what to eat, and now they feel hungry all the time. That's not what this is. Right. So we add things in before we start taking away, and then we start crowding out some of the quote-unquote bad behavior. If you're eating, a McDonald's diet, everything else in health is going to be stunted because of that, right? But you can't always stop right away. So what do we replace it with? People say, oh, it's going to be salads. I'm not a salad eater. Meat. I'm a carnivore. I like carnivore diet actually for men specifically because guys are light switches. It's on off, right? So with a carnivore diet, it's binary. It's can I eat? Is it an animal? No, then you can't eat it. It's very, very simple. But I like, for most people, for long term, I like a more traditional diet where you have some grains, but they're more limited, vegetables and meat. The quality of meat really matters. I don't want to say ratios because I don't want people measuring things, but I want them back to eating food. I had a patient some years ago. She should have known better. She was about 80,
right.
And she had a lot of inflammation. I wanted her to stop eating all these box foods, and she got mad at me and she said, "What am I supposed to eat then?" I'm like, "You're 80. You grew up on food."
Exactly.
But it slowly changed over time. So even the foods that we eat, they look the same, but they're not the same anymore. And they also added in these little conveniences, so they slowly boiled the frog, right? It's little by little, it changed us until we didn't recognize what we're actually putting on our plate anymore. So I just try and slowly walk them back to food. I want you to recognize what's on your plate. I want you, I'm not going to say never drink a soda, but if there's a choice between something like Coca-Cola or something that has cane sugar in it, I'm going to go with cane sugar,
right.
And make it a treat like it used to be. I drink carbonated water.
That's a treat for me because,
me too.
Yeah, and I don't do it every day, but it's just kind of like, ooh, healthy pop.
I do mine fairly frequently because when I cut alcohol out, like now I'm like, I probably shouldn't drink this stuff hardly ever. So my replacement for that was carbonated water. Dr. Berg talked about how carbonated water actually stimulates the parasympathetic nervous system. And I was like, maybe that's why it works, because in the evening when you just like, you want something, there's no sugar kick to it.
True.
There's no alcohol in it, and it does seem to just satisfy that something. So I put a little bit of honey in it, not much, just a little bit of honey, and lemon. Oh, sorry, lime. I like lime better, but a little bit of lime and a little bit of honey, because it takes out that aftertaste you get from the carbonation.
Right.
And that's it.
So I know you said with patients now, I like this because I think it has to be a process. I think when you're like over here and you tell people to go over here, it's truly not realistic.
Right.
And a lot of people are going to drop off probably even after week 1 if they even get through it.
Mm-hmm.
In addition to, like you're saying, slowly adding in some healthier things and educating patients, what's the next step with patients for you to help reduce inflammation and help people feel better?
There was a doctor, he always sticks in my head. I believe he was an MD. I can't quite remember. It's been about 20 years. But one of the things he said was he gets patients off of the common inflammatory foods first and says, give it 8 weeks.
Now, such as, I know some of these inflammatory foods, but what would be some big ones that you would say off the bat?
So for a lot of people can't handle dairy.
Correct.
A lot of people can't handle things like peanuts, corn, especially the way it is now, wheat, especially the way it is now. So he has them come off of those first, and then he says, give it 8 weeks. You might not even need me. Maybe that's enough, and maybe you'll feel great. But even if that doesn't solve your problem, it kind of takes some of those players off the table so we can actually see your symptoms and your body better. It's really difficult to see what's going on with your body if you come in and there's 50 different things going on, right? So if we can reduce some of that inflammation just by making those changes, then when you come in, I can see a little bit better as to what's going on.
So can you think of a specific patient that, all this stuff that we're talking about, inflammation, food, eating, digestion?
So I can probably talk your ear off about this one, but the best one that I really like to share because it's so simple. I had a patient, he was coming in, he had a degenerative type disorder, but you talk to your patients, what else is going on?
Right.
And he had some digestive disorders. And I said, well, let me work on that too. He's like, everybody's tried, nobody can figure it out. They've had medications and all that kind of stuff. And I said, so I talked to him a little bit more. He had bloating, he had gas, and they couldn't figure out what was wrong. So in talking to him, he's a guy, and guys eat more like snakes, one bite and swallow. Right? You can actually see the hamburger go down. And that's all I had him do for a week, just consciously chew your food. I said, you don't have to chew 32 times. I was like, but chew more than twice.
Right.
And he's like, yeah, that's not going to do it. And his wife laughed and came back. He was like, I can't believe that worked.
Isn't that amazing?
So what I love about that story is that people forget. So Chinese medicine, again, we're all about balance. People forget how important the whole process is. Did you know there's a an enzyme in the saliva. So of course to help the amylase to help break down the carbohydrates,
Right.
but there's also one to protect B12 to make it through the digestive system into the intestines. Like, so if you don't chew your food, there's that. But on top of that, people, acid reflux, and they say, my stomach's too acid. I've never met a person who had
No.
too stomach acid. So if you reduce your acid, and now your pepsinogen can't turn into pepsin because there's no acid to combine with. You can't digest red meat, especially red meat. You also can't get your B12. It goes into the intestines. Nothing is digested correctly. It's rotting in your intestines instead of digesting. Right? And now you've got inflammation. And you're like, I don't know what's wrong with me. Yeah, I do. Stop taking Tums. So everything, it's kind of like a symphony, you know? And it's like the symphony works great when everybody's playing well together, but when the tuba player shows up drunk, it throws everything else off, right?
That's a great
so that's kind of what happens. And so, but then what I think I don't have a better way to say this, but I think the failure of the Western medicine system is they're amazing at fixing an emergency situation.
I agree with you there.
But the failure in the Western system is when it's not broke, they don't know what to do with it. So the tuba player is there, but they can't pick up on their measurements that he's playing at a sync. So their attempt to compensate for that and take over for the body often makes it worse. So they'll give antacids, and that actually makes it worse. And a cascade of just bad things happen after that. And where it was such a simple fix, now you have 5 different things wrong.
Correct.
Instead of just trying to enhance and get that back in balance. Now your inflammation is going crazy, and you think, oh, it's just age, I'm just falling apart. Meanwhile, maybe it's you just didn't chew your food, or maybe it's just because you're taking a Tums or drinking too much water and you're 80, you know, and that's diluting your stomach acids. So a holistic approach, of course, because we're holistic doctors, but a holistic approach I really like better because we're looking at the whole orchestra and seeing who's not doing their part and how do we bring that back in sync, you know, and it's amazing how many different problems or even degenerations can go away when you have everything working the way it's supposed to work.
Exactly, our body is an amazing machine.
Oh, it's incredible. And the more you study it, the more you're just in awe about how does this all fit together. It's crazy how it just keeps going. And despite the abuse we put it through, it just keeps going. And there's all these mechanisms to tell the body how to regulate. It's really amazing.
I mean, just even like you're saying, just that patient with just, hey, chew better, chew your food. You know, sometimes obviously you have to do a little bit more, but sometimes you just make one little shift. You help, you know, they're struggling digesting fats because they're missing a gallbladder. I mean,
Right.
we can talk about that for probably half an hour because that one frustrates me. But just something like that, just supporting fat digestion, how everything can reset in the body, hormones and everything.
Yeah. Well, so that's a great example because a lot of doctors don't tell their patients that now you're going to have trouble with digesting fat.
Right.
They tell them, but they don't tell them. And it's such a simple thing to help compensate for. I've had patients for 20 years of problems, and it turns out they have no gallbladder, and you just give them one supplement,
Yes.
and it changes everything.
And we both know
right?
what those supplements are.
Yes.
Correct.
But what happens when they can't digest fats? Well, they tend to be more round in shape because the body goes, well, if you're not going to give me fats to use, I'll use carbohydrates. And now they tend to fatty liver. Now they have more inflammation.
Right.
Now they have blood sugar issues, all because they couldn't utilize fat as a source of energy, so they had to use carbohydrates. And carbohydrates, it's more like throwing gasoline on a fire. It's now, but then you store whatever's not used now, and that gets to be complicated, not for you complicated, but to try and explain to patients that the calorie system is not great, and carbohydrates, it's for energy, and blah, blah, blah. But balance is just easier for them to grasp, and everything's got to be working well together. So and then you can really get rid of a lot of inflammation just by getting things to work well.
So what sort of emergent trends are you seeing in your discipline?
Actually, there's a few. So some things that I find a little bit troublesome is so I'm going to pick on the keto diet at the moment. It's not the keto diet that's the problem. It's the keto diet, and then you have the keto diet who people are doing keto diet. But then you have the keto diet people who seem to have jumped on the bandwagon and they found a better way, and it's all chemicals. So in the pursuit of weight loss or health, sometimes some of these internet gurus and YouTubers and social media marketers, they're chasing calories, and I hate that, because calories is actually a machine measurement. Doesn't really apply well to us. So if you're chasing calories, you fall victim to the marketing scams of no calories.
Right.
Yeah, but it's got a bunch of chemicals. I don't know if you know Dr. Barry Groves. He's an MD from the UK. It's a great story. So he came to the United States, and he was in a grocery store, and he said, I'm just going to kind of look around. And he saw sour cream on the shelf, and he said, sour cream, and then fat-free sour cream. He said, how can you have fat-free fat, right?
True.
So he picked it up, looked it over, and he said, oh my God, they took out all the good healthy fat, and they replaced it with just horrible chemicals. Because when you're chasing calories, I think you're chasing smoke, and then people can, let's say the companies are well-meaning. Well, but they're looking through a microscope. They're well-meaning, but they're replacing healthy fat with chemicals that your body can't use and might even be harming you. The chemicals that are safe and effective today are not so much down the road.
And I would say they're always harming you, in my opinion.
I think so too.
It's not
It's
natural.
just time. It's always just time.
Right.
And it's like, well, what's safe today is not safe 10 years from now when we learn more. Like, oh, we didn't know. Why didn't you know? It's a chemical. Why did you take out a healthy fat and replace it with a chemical? Well, because people wanted, less calories. Because they're going off of bad data. So that's to me, that's one of the biggest ones, is the chasing calories instead of what the food actually is, how it's grown or raised over chemicals. So I think that's probably the biggest one.
I have another one. What about this? Because this is outside of your discipline and outside of mine, but I'm very frustrated with this whole semaglutide and the Ozempic, like all of these types of things too.
So we don't know the damage that's doing.
And I should be
right?
careful of saying this as
No,
well.
I think you're right in saying it. I think there is damage.
Correct.
And I think we're starting to see some of it. They have Ozempic face, right? And they're like, Ozempic face, well, what is that? Well, because you're losing fat so fast. Okay, but what else is that doing to the body? And the truth is, we don't know. So before we go to Ozempic, before we go to stomach bands, and before we go to chopping off a limb so we can lose 10 pounds, before we get there, why don't we just get rid of chemicals, reduce sugar, get rid of seed oils, and get some vegetables and meat into your diet and stop drinking. Let's do that first. And then if we need to lose 20 pounds, we can take off the left leg or something. But, it's probably safer than Ozempic. That's just my opinion. But I kind of feel like if you did a belly, a gastric bypass or something like that, to me that's pretty severe. But if you had no other option, there's complications that come with that, but it's better than dying. Okay, and you're like, I'm living with those complications. But if nobody talked to you about how to get rid of these chemicals out of your system, how to get rid of inflammation, how to digest better, how to reduce the impact of blood sugar, if we didn't have that conversation yet, why are we going to extremes? So I agree with you. Maybe it's not as bad as you and I think it is, but it's not a first step. It's not even a 10th step.
Well, and I even think too, how long has this been going on? What's going to happen 20 years 20 years from now, these people, 30 years from these, we don't know.
We're getting a glimpse, because one of the things we're finding is that Ozempic reduces muscle mass. And not just muscle mass, it actually increases fat cells. So you come off of Ozempic, and now you will get fatter quicker because you have lowered your metabolism, lowered your muscle mass, and increased your body's ability to store fat.
And I guess my thing is, I'm aware of that, but just like even further along, like yes, that happens to these people once they get off, because then they're dependent on all of this. But what happens later on? Is there going to be other impact with
Almost
insulin,
definitely.
with their pancreas? Like what else is going to go on later?
Well, how many lawyer commercials do you see? It's like, have you or somebody you loved, been injured by this chemical that you should have known better about? It's like, it's the marketing. And I don't blame the patients. I blame the system for not saying, okay, I understand you want to lose weight. Let's do these basics first. Right? That's why I want to do the foundational course, because like before we get to anything, and I want it to be free, so there's no excuse. I'm going to walk you through this, because everybody, before you do anything more extreme, let's do some basics first.
Right.
You know?
And I think the frustrating thing for me is because we see it like this, but a lot of people, they just want the quick fix.
Yeah.
And health is a journey. Like, it takes time to make these,
Yeah, the quick fix always ends up being more costly, almost always. And our whole practice is built on such things, and it always comes back to get you. You gotta, was it worth it? If you need to drop 20 pounds for a wedding coming up in 6 months, and you can do some fasting, you can do a protein sparing limited fast, which drops weight really fast,
right.
Without compromising your system. But it's a little bit of effort. Not that much effort, but it's a little bit of effort. But you'll drop weight fast. But I don't think you want to stay there, because you're really eating very, very, very low fat and very, very simply. But I don't think you want to live there. But it's like, well, I have an event coming up. No problem. But I think the problem comes when the marketing companies kind of prey on our insecurities, also prey on false solutions, and they portray things as being healthy based off of metrics that you and I wouldn't agree with. And the people shopping, they want to believe it because they, it's preying on their insecurities, and we're all fall victim. There's a few people online I see all the time. I'm like, I really want to order their course because I don't know how they can back up what they're saying.
Right.
But they're making a lot of money,
So how can people advocate for their own health with their healthcare professionals?
They can't. They're screwed.
Okay.
So here's the problem. And it's partially our fault as patients. MDs don't have any nutrition training, but we expect them to, and they get a little bit of a God complex, and I don't think that's their fault. We expect them to know all this stuff, so they are giving bad advice. I think best thing you can do. I'm a fan of chiropractic. Your chiropractor probably knows more about nutrition than your MD does. I think that's a better conversation to have with your chiropractor. Of course, my background is Chinese medicine, but not all Chinese medicine dives into the nutrition as much as I do. So I think your chiropractor is probably your best bet. And your MD, you always want to keep your MD in the loop. It's not that they don't care about it, but they don't have the training to give you good answers. I've heard MDs tell patients, take a Tums a day and that's enough calcium. That is the most ridiculous and harmful thing
Correct.
I can possibly think of that seems so innocent, but it really, really isn't. And it can cause a lot of damage. So you have the conversation with your chiropractor instead. If there's a disease situation set in, then you might talk to a nutritionist or functional nutrition. But for just trying to advocate for your own health, I think you keep that conversation away from the MD, do it with the chiropractor, but you let your MD know what you're doing.
Now, if they don't have a chiropractor, because some people don't see chiropractors, what are you looking for? Because I'd like you to touch upon this. A lot of people don't know nutrition isn't just nutrition when they see that word. There's nutritionists, there's functional nutritionists, then you've got this dietitian thing.
Yeah.
It
gets confusing.
It does.
So first I'll touch on functional nutrition. I don't do meal plans.
No.
So my practice is on function. So what I'm looking at is, how does your body function? And nutritionally speaking, how do we either support or reestablish balance with nutrition? It's food, of course, but it's also supplementation. As an example, so we were talking about stomach before. If you came in, you're 75 years old, and you're not digesting well, you're on acids. Maybe, in that situation, maybe that you're not digesting meats very well because you're not producing enough stomach acid. So maybe the solution for that is to supplement there, and maybe it's also not drink so much water at mealtime, right? Easy fix,
right.
Hypothetically, right? So that's restoring function. But then you have dietitians. In my view, dietitians mostly they're mostly trained for hospital settings and for disease care. Now, the modern ones might disagree with me, but I was going to go to school for that. That's what I saw, and that's traditionally what it has been. If you don't have a chiropractor, nurse practitioner will probably know quite a bit about nutrition. Naturopathic physician, will obviously know quite a bit about nutrition. I am absolutely not an advocate of vegetarianism. But if you're a vegetarian, you're going to want to find somebody who actually believes that too, because that's your belief system. I don't think that's a thing. So which always makes the vegetarians mad at me. But I thought I was being so gentle, and I told one patient, I said, well, that's great that you do that. I'm not going to comment because I don't see how to do that and be healthy. So I'll let you have that conversation with whoever's helping guide you. And this way I'm not interfering with that. Boy, was he mad. Yeah, he very, very angry. But, we have to be realistic of what our limitations are.
Correct.
If you're a vegetarian, I'm not going to comment about your dietary because you've made up your mind that's what you want to do. I can't guide you in that.
And I was going to say, it can be very difficult for me. I would struggle working with a vegetarian, and I also have to realize there's some religious, I have to understand people's religious decisions and different things too, so sometimes that's hard. I mean, they're doing it for that reason. But a lot of people don't realize that we do need things in animal products. We need them, we need the fats, we need this.
Yes.
I mean, there's very important things in animal.
Well, so that's the conversation at the beginning, right?
Yeah.
And Dr. Dobbins, Michael Dobbins, he was great.
He was wonderful.
He was fantastic.
Yeah.
But he would ask, why, right? And it's like, if it's religious, then, right? But sometimes the answer is because it's healthy. And then we can have a conversation. I'm not going to try and change you. So if you're a vegetarian, I'm not going to try and change you. I'm just going to leave that alone because you've decided. But if the answer is because I think it's healthy, then we can have a conversation. If it's religious, we don't have a conversation.
Exactly.
I'm going to leave that alone. My job is not to bludgeon you into a different way of doing things. So you have to, when you're advocating for your own health, you have to find somebody you can have a conversation with. I just don't think it's fair to put it on the MDs when it's not their training, and they're going to answer to the best of their ability. But I heard an MD tell a patient also, take magnesium oxide for magnesium. Magnesium oxide, because the literature said it was the highest form of elemental magnesium you can get, which was correct. It was also lowest absorbed. It turns into magnesium hydroxide, which is milk and magnesia. This poor patient had explosive diarrhea.
Well, and that's another thing is just bioavailability of nutrients. And that was something even with my mother I had to educate her on. She was having some issues. She was osteopenic. So, and, I'm switching her to a whole food calcium versus the thing as she's on. And she's looking and saying, Kristin, I need 2,000 milligrams of da-da-da-da. I'm like, you really don't. It's all about bioavailability. And with her, it was supporting digestion. And guess what turned around? Yeah. But apples, you can't look at things as all being the same. No. You really have to understand the source.
And so I tell my patients that, like, you're the scientist, I'm the interpreter. That's all I am, right? So if we're working together on nutrition, you have to give me data to work off of. I'm going to tell you what I want you to do. I'm driving the ship, but you're giving me data. You have input. If you're going to go to Dr. Google, that's not the final word. You can come back with it, sure. We'll have a conversation, but don't go changing things, because if you change things I don't know about, then we don't know if we're on the right track or not. And so, coming back full circle, because I don't want to ignore the question, I just think that if your doctor, your MD, doesn't have the training and interest in that, don't put it on them, because they will try and help you, but their help, like with the magnesium oxide, won't be good. Talk to your chiropractor, nurse practitioner, functional nutritionist. Talk to friends and family who may be working with somebody like me or like you, that can maybe help them. But you want to work with somebody that you can talk with and you can work out problems, because nothing's ever straightforward, especially with the body. So we need feedback. We need to be able to work together and figure it out. It's usually not that complicated, but if you have somebody giving you bad advice, then you think it's just you. Meanwhile, it's because you're taking really bad supplements.
So I know we've been discussing dietary changes, lifestyle, digestion, things you can do to reduce inflammation in the body. I've been seeing so many amazing results with stem cell therapy. Are you well versed in that? What have you seen? What do you know?
So stem cells are really cool. So a few different things from my point of view. So my practice nowadays is a little bit more focused on digestion and blood sugar balance. You can do a lot with supplementation and with dietary changes, but sometimes you have multiple things going wrong, maybe from years of abuse and age, it's just too long of a road to get to healthy. Stem cells will help there. Right? When you have a problem, you can't produce enough stomach acid, you've got leaky gut syndrome, your liver's not functioning the way it's supposed to, you have too many moving parts that I can still get you there with supplementation eventually, but there's too many things. Stem cells, from what I've seen, what I've read, should help to shorten that road, because it encourages not just the anti-inflammation, but also encourages the healing part. So from a Chinese medicine standpoint, it's kind of like the old Chinese masters, they were chasing elixirs, and to basically revitalize the body. That's kind of how I view stem cells. You're basically turning on the switch to actually heal, where when you were younger, you just did it automatically. But as we get older, it's not there. There's a lot more effort to heal. When you've got several different things going wrong, stem cells can help by turning that switch on so you can self-heal. And now you can get back to normal, because ultimately what we want is, we don't want to be dependent on a bunch of medications or supplements, whatever else. We want the body to be healed and in balance. Stem cells, to me, looks like a shorter road to get to there.
So I think for me, it's something I was looking into. I know we know each other personally. I was originally looking into things with my brother with his traumatic brain injury, and it's been amazing. And I have my parents. I love them with all my heart, and everybody can truly benefit from stem cell therapy. So with my father, he's in his 80s, full system issues. I mean, he's arthritic from head to toe. He was a Division I football player years ago in his past life, but he's on insulin, full-blown diabetes, kidney disease, and he was in stage 3 kidney failure, and the next step was not going to be a wonderful choice.
Yeah.
So, it's funny, when I gave him the stem cell, I knew it was going to prove something. The way we're doing it is, it's an IV push, so basically your body's going to bring it to the place where it needs the most help at that given time, which for me is exciting, because we don't know. Your body knows better than we know. And with my father, it improved his GFR, his kidney function is improving. So to me, that's huge. And there's nothing that I could do with everything in my wheelhouse, and even the medical professionals. I mean, really what they were doing is just monitoring it. There really wasn't anything to bring it back up.
So what I like about that is, it's still a holistic approach.
True.
So with the way we view the body is, endocrinologists will say, well, this hormone is this too low and this is too high, and they will bypass the autonomic nervous system to introduce those hormones,
right,
or whatever the response they want. But a holistic approach, and to me the stem cell is still a holistic approach, we're going a little bit more to a root, and with a raw material, and we're saying, here you go, body, what do you need to do with it? Do what you need to do with it, right? And so when you have so many different systems failing, it's not just systems failing, it's showing you that the body is not capable of doing that healing process. So you go to a more base, support system like stem cell, and let the body do what it's going to do with it. So yeah, I think it's fantastic. I think I don't know. Did you hear the story? I think, was it Mel Gibson's father had a stem cell? Oh, yeah, it's a good story.
So tell me real quick, because I can't leave with you.
Well, if it's Mel Gibson, I'm pretty sure it's Mel Gibson. But his father had some stem cells, and the biggest part of the story was that the nurses said he had more vim and vigor.
Oh, interesting. Okay.
So yeah, he was more feisty, and it's like, these are things. So as an 80 or 90-year-old man, for male function may not be the thing we're after.
Correct.
But it is still a barometer of health.
True.
So when we are healthy, all these things work correctly. Sometimes we can't look at somebody and be like, "Wow, your kidneys look pretty good today."
Right.
Like, you can't see that from the outside usually. But other things that seem like they're not connected, that are working well. When you see an older lady with shiny hair and it looks good, for Chinese medicine, her blood's good. Her essence is good. So these things, they matter. So when you're able to encourage healing, it's not just that one thing. It's overall. That person has more vitality.
Correct.
And that's ultimately what we want, right?
So Dr. Rick, how can patients get a hold of you if they're interested?
So thank you for asking that, actually. So I transitioned from my regular brick and mortar practice. Now I just have a newsletter. And basically my newsletter is to teach people about digestion and blood sugar. So if you go to yourvitamin.guru, That's my newsletter.
All right, wonderful.
Thanks.
Dr. Rick, thank you so much for joining us today.
Sure, I appreciate it.
And
That's
I'm
great.
really excited about doing this again because I know we can talk for hours and hours and hours upon end.
Yes, yeah, we have to be reined in, I'm sure.
I'm sure we do.
Thanks for having me.
You're welcome.